Hi, my name is Leanne. I'm going to be presenting my case study today on a case study I've been following at Maternal Fetal Medicine Center. It's a case study on Spina Bifida. So I'm going to be showing you 3 different visits from this same patient. Her first visit, and all the ages are going to be on the bottom. So first visit was for 12 weeks gestation. She does have pre-gestational diabetes, and so they let her know about sequential screening. Really quick about sequential screening, it's a really hard word to say. They're going to be taking in to factor the mother's age, so if she is AMA, then also the nuchal translucency measurement, and then they're going to pair that with the genetic screening results. So as normal, we did a heartbeat first, we got some normal anatomy, legs, arms, hands, and a nuchal translucency measurement was normal. It's really hard to see that one. They usually look a little bit better for this one. So it was proven 12 weeks stay gestation. The report says everything looked fine. The nuchal translucency measurement was below the abnormal results, and the patient was going to have blood drawn to do that sequential screening. And so the doctor went over exactly how that works with her, counseled her. So again, everything was normal for this scan. She comes back next for 15 weeks gestation this time, because she had a positive screen with that sequential screening, and she still has diabetes, but this time they're looking at the foot. So in these images, you can kind of see how the feet themselves are splayed, and we go through, we also see an abnormally shaped head. Here it is again. You're also losing kind of definition of the brain material itself. You can see it's not symmetrical inside of the brain. The cerebellum and the cisterna magnum were showcased, and you can kind of see how they've been splayed or deformed. And when you take the head measurements in comparison with the abdominal measurements, you can see that the head is a little bit lagging in comparison to the body. Oh, sorry. Anyway, 15 and a half weeks is what the head was measuring, but the body was measuring around 16 in 4 days. So still, it's a single pregnancy, and this time they talked about how it was hard to see everything because of the mom's BMI, but they were able to confidently say that there was a lemon sign within the head, the banana sign showing the cisterna magna and cerebellum, and a clubbed right lower extremity. They couldn't see the left one yet, but they will come back and look at that later. So there was no direct evidence of lumbosacral NTD at this time, but such findings typically evolve as pregnancy advances. And that's kind of the whole thing about this case study is it was interesting for me to see how things start advancing once the fetus gets some age on it. But the remainder of the fetal survey was limited, but it looked apparently normal. So the next one she comes back in for is an 18 weeks gestation. History-wise, she still has diabetes, she still had the positive screening, clubbed right foot, and now they're going to be going in and looking for the area of spina bifida, because this is what they're suspecting, and for the looking inside for the brain abnormalities, I would say, central nervous system abnormalities. Speaking of central nervous system abnormalities, spina bifida, if we look at this picture here, happens when you have an outpouching of the spinal fluid, the membranes, the cords, and they'll protrude through somewhere around the spine. And what happens to the brain itself is it loses contact within the space, the cavities of the brain, and it kind of starts to fall down through the foramen magnum. And you gain a lot of extra space within the brain. So when you do a transverse measurement, you kind of start to see a lot of anechoic spaces that shouldn't necessarily be there. So let's look at the images from this case study. Again, we're going to see that typical lemon sign, which is very indicative of spina bifida. We're going to do some measurements and BPD, biparietal diameter, and then also one around the head. And they're also measuring the ventricles here, the lateral ventricles, and they show that they're abnormal. These are high measurements. So they're going to take very careful use to look at the spine, or very carefully look at the spine. They're going to try to look to see where that opening is, and they did tell that there was an opening far down in the lumbar, more towards the sacral area in the baby. And they're going to measure that. And they also were able to get a glimpse of the other foot, and were able to confirm that this baby did have clubbed feet. And they're showing how the right legs, there's some like bowing internally, it's rotated. Again, the head measurements have a lag to them, although this is an 18-week, 4-day, almost 18-and-a-half-week baby. The head measurements lag behind the abdominal and femur measurements. So the report was that the baby was appropriate for the growth, but it was in the 50 percentile, and in accordance with recommendations from top gynecologists and obstetricians in the field. Transvaginal cervical lift was performed to screen for risk of preterm birth. But the cervical lymph was fine. It measured 4.6 millimeters, which was beyond, what is it, 3.5, I'm sorry, centimeters and not millimeters. And it's associated, it's not associated with a risk for spontaneous preterm birth. So some statistical analyses from the CDC, which is the Center for Disease Control, talks about in the late 90s how we kind of fell away from eating whole-based foods. A lot of things started becoming packaged and started becoming quick and ready type meals. And we kind of got away from eating foods that had natural folic acid in it. And folic acid, or folate, it's just B9. It's a B9 vitamin. And so what the federal law did was they made a synthetic vitamin. It's called folic acid. And they put it into pretty much everything that's shelf stable and not, like cold cereals and breads, pastas, crackers. But you can find naturally occurring folate in almost everything that you eat, like leafy vegetables, melons, fruits like bananas, even yeast, mushrooms, meats. Orange juice, tomato juice, and this folic acid is what's needed to prevent deficiency, women who have folate deficiency. Because if you have folate deficiency, what you're going to have is you're not going to be able to have a really good embryogenesis, which is the forming of your body when you're just a little disc like this at 28 days, your whole spine. Everything's going to tighten up and close, and if something hasn't closed by then, that's going to give you an increased risk for developing spina bifida. So the birth defects of the brain and spine, these are called neurotube defects, and folic acid during pregnancy reduces the risk of having neurotube defects, and it's recommended that pregnant women take about 600 to 800 micrograms of folic acid a day. If you are a woman who has had a previous baby with spina bifida, then you're asked to take up to 4,000 micrograms of folic acid per day. Women who are pregnant or might become pregnant, they take this B9 to prevent miscarriage and also neural tube defects. These birth defects occur because of the deficiency in folate and creates spina bifida and other central nervous conditions. So right here is an interesting picture. I doubt we'll ever get to see this again because it's an MRI of a fetus with spina bifida. You can see right there at the bottom the protrusion of the spine out of the spinal column itself. And as I was looking around for treatments, I came across this really interesting video about a doctor in Israel who studied in Brazil, and these two countries are trying to train doctors to be able to do this interesting treatment idea, and I'd like to get your opinion on it. These are still shots from a video that I watched, and you are actually in a camera here inside the amniotic fluid. I know it's not great, but this is a baby. Here's a baby's mouth, and there's the body. So you're in vitro here. So what they do is they suck out all the amniotic fluid, and they replace it with carbon dioxide. It's the baby's hands. You're still in vitro. They're just I just wanted y'all to see the captions here. And they use anesthesia on the mom, and they put the mom under, and that also puts the baby under. And then they go into the gestational sac. This is inside with no amniotic fluid. The carbon dioxide has inflated the womb, and now they're able to go in and do spina bifida surgery live on a baby who hasn't even been born yet. That's it.